And it is 8:30 at Metabesity 2019. Pat Benatar, hit it with your best shot. And we have been seeing that all during the meeting, people hitting it with their best shot. What a great gathering this has been. Today is going to be just as exciting and as important. So we are so glad that all of you are here. We have distinguished speakers to begin our session, and we have distinguished speakers all the way through to the very end. And so I hope all of you can stay to the end. Now, I do want to, let's see if we can queue up. Okay, good. Let's see, I'm not sure maybe we need the next sequence. This would be the opening deck. Yeah, there we go. First of all, maybe this is me, but all right. Technical problems here. Better now than later. Let's see. Allison, can you help? All right, now we're on it. I did want to mention this very impressive report that's just come out from our colleagues at the Aging Analytics Agency. This is an 80-page report. The bottom line, as I mentioned, is that the U.S. is near the bottom in terms of its investment and its activity in pursuing health span improvement. And we'll get much more into those details throughout the day. But this is very worthy of your attention. You have a flyer in your meeting material that will allow you access to that report. So check it out. We are delighted to be collaborating with our friends in the Aging Analytics Agency. It's a multinational organization, and we'll be hearing from some of those folks later in the meeting. And this is the link, but you'll find that in the meeting material. Now, we won't go through this again, but yesterday we talked about the big gap that we have between making available products that could help people to have longer disease-free lifespan, health span we call it. We did science in spades yesterday. I mean, we wanted to go all day, but obviously time was limited. We talked a little bit about clinical trials, and we'll come back to clinical trial issues later today. We talked about regulatory approval, and that sort of made it sound like we were talking about drugs, but no, we're talking about any product, including a digital app or a nutritional product that could advance the health span field. And we talked about the importance of support of investors, the government, and the necessity in this very complicated ecosystem to have a way to get evidence that's going to encourage people or organizations to pay for these products, whatever they may be. Ultimately, the decision has to be made by the consumer and the advisor, and that's not going to happen without the support of different funding organizations. The real hard part is the compliance and adherence to whatever the product is. And this will take many decades of commitment to do it right and without having symptoms that would necessarily encourage the person to stay on that product. Ultimately, we need the data. That's the key. We've got a lot of good prospects for improving health span, but it's hard to get the evidence. That's the catch-22. We'll come back in a moment to that in a lot more detail, but I want to give you an example which is literally food for thought. Now, this is a very unusual trial. It's typical in that it's a cardiovascular outcome trial, 22,000 people, men and women, who are going to take either placebo, or no, we're not a placebo, they'll be going against an active control multivitamin, and using what is now a supplement, an extract of flavanol. Now, this is a serious trial, and it may reveal that there is a benefit in using this product. But what will be the incentive for other companies to do such trials? This is sponsored by a very wealthy private company that could make this bet. Will they continue to market it as a nutritional product, or will they have to get an NDA and make it into a drug? And would they then take it off the market as a consumer product? Well, again, food for thought. So we've got a wonderful day ahead of us. Enough of me. Let's get on with Dr. Larry Steinman, my esteemed colleague, professor of medicine at Stanford University.
Thank you, Zan. So I'm a visitor to Washington, a frequent visitor, and we don't have a king or queen in this country, fortunately, but we do have what we would otherwise call crown jewels. And two of the crown jewels of the United States of America are the NIH and the FDA. And the NIH is something I'm particularly familiar with because they've supported my lab for decades through the extramural program. But a great source of inspiration is to go out to the campus in Bethesda and to see this magnificent campus that's all devoted to health research. And one of the most important institutes, obviously they're all important, is the National Heart, Lung, and Blood Institute. And we're honored to have the director of that institute, Dr. Gary Gibbons, as our first speaker this morning.